You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is that I talk to people, so healthcare providers, patients, family members, and the general public about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a medication you're taking, a chemical at your workplace, or a vaccine. And that's what we're going to be talking about today. Not just vaccines, but how and why they are so important. Our guest today is Dana Howe, Communications Director for a nonprofit called Vaccinate Your Family. She holds a degree in biology and community health and a master's in health communication. She is also a very soon-to-be mom. Hi, Dana. Welcome to the show.
Hi, Chris. Thank you so much for having me. I'm really happy to be here.
Our pleasure. So first and foremost, how are you feeling and how is your pregnancy going?
I am feeling pretty good. It is, this is going to be my first baby. So I'm going through this, journey for the first time, learning a lot along the way. It's been really interesting how it's intersected with my professional work with Vaccinate Your Family a little bit. But overall, feeling good. I'm in my third trimester and due next month. So things are getting real around here.
That's amazing. Congratulations. And I hope that the remainder of your pregnancy and delivery is smooth and safe.
Thank you.
So can you tell us a little bit about the organization you work for called Vaccinate Your Family?
Yes, absolutely. So I am the communication director at Vaccinate Your Family. We are a nonprofit organization that was originally founded in 1991, formerly called Every Child by Two, started by former First Ladies Rosalind Carter and Betty Bumpers of Arkansas, in response to measles epidemics that were happening at the time and the need to vaccinate our nation's children against the vaccine preventable diseases of the time. Our mission today remains to protect people of all ages from vaccine preventable diseases. And we do that through a mix of communication work, trying to educate and arm trusted messengers with good information about vaccines, as we serve as the subject matter experts and try to work with trusted messengers, community-based organizations, leaders, parents, often really health decision makers, to spread good evidence-based information about vaccines. We also work in vaccine policy, and then we follow the science, basically, to stay on top of the latest vaccine recommendations that are coming through, and there are new vaccines. There's a lot of really exciting work being done. And I actually joined during the COVID pandemic. So it's been a really interesting time as a health communicator to watch how the experience of going through the pandemic has impacted the way that we all think about the vaccines that we need, not just against COVID, but against all vaccine preventable diseases.
I would agree. As someone who was part of the efforts when MotherToBaby was answering a lot of the questions about the new vaccines during the pandemic, it really did change our perspective. And of course, I'm a mom, I have my own perspective. And, really soon, you're going to be a mom too. And so can you share a little bit about your personal experiences with vaccination and pregnancy?
Yeah, absolutely. So, I work in vaccines. I work in public health. I have always had a high level of vaccine acceptance in my family growing up. Myself, generally happy to get the recommended vaccines at the recommended times. But pregnancy has been a really sort of interesting time where there are now a few recommended vaccines during pregnancy. The Tdap vaccine, which is important for protection against whooping cough or pertussis, that you can pass antibodies onto your baby when you get it when you're pregnant. Flu and COVID are more important than ever to get while you're pregnant. There are extra benefits to getting them while you're pregnant. You can pass some immunity onto your baby, but also getting sick with flu or COVID during pregnancy is something you really want to avoid. It's more dangerous because your immune system doesn't work the same way while you're pregnant. So if you were to get sick, you are at higher risk because you're less able to fight off those infections. So that extra boost is really important. And then we now have a maternal RSV vaccine as well that can pass antibodies onto babies. And I'm concerned about RSV, certainly as someone who's about to have a newborn in the middle of RSV season. And the ability to pass some antibodies on and get that vaccine during pregnancy is something that I don't want to miss out on, and I'm actually really excited about. But I will say, so far I've gotten 3 out of those 4 vaccines, and in making my own health decisions during this pregnancy, I'm very aware of all the things that we weigh when we're pregnant. It does feel in some ways like a lot of vaccines, and I feel that way even as someone who is for the most part excited to get them. Of course, I'm not excited for if I feel a little sick the next day, like that's not great, but I'm happy that I have the opportunity to get them. Yes. But still I've thought about, the timing of those vaccines, what is available at my doctor's office, what information am I getting from my doctors? So, personally, my doctor's office had Tdap available a little bit sooner, so I just said, sure, did that at like 28-week appointment. And then at my 32-week appointment, I actually proactively asked about the RSV vaccine because I, work in vaccines. I was curious, like, so do you have it here? Are you giving the RSV vaccine? And they did, and they said we also have flu available. So I did RSV and flu at the same time at that appointment. And then I'm scheduling my COVID vaccine separately at a pharmacy. So, I'm very aware of, as I navigate this time, like what's available to me in which places, how do I feel after each vaccine? I know that's definitely a concern. And, recently I got a little head cold, and it was a good, gentle reminder of how much being sick stinks, especially while pregnant, and how much I had been weighing this thing of like, okay, I'm like many people who, when I've gotten my COVID vaccine, the next day I feel a little under the weather in past vaccines, like that immune response. And so I've been like, oh, when is going to be a good time to do that? I'm putting it off. I'm noticing myself being a little like, well, it's already hard to feel good in your 3rd trimester of pregnancy. Do I really want to take a sick day? Am I going to be like, how is it going to feel? But then I actually got sick with just a head cold. And I was like, nope, we got to go get that vaccine because this is, even just this head cold is much worse than that day after the vaccine feeling. So it was a good little reminder for me that those transient, mild, for me, it's like 24 hours of fatigue, soreness after a vaccine that sometimes we see is still worth it. Yeah. But it can be tough to convince yourself that. So that's just a little bit of what I've been experiencing as I kind of navigate this from a personal perspective.
So what are some common myths you hear about regarding vaccines and pregnancy or breastfeeding?
Yeah, so I am lucky. Something that's been really interesting is I have quite a few friends who are navigating pregnancy at the same time as me. So it's kind of been a topic of conversation. I'm also in some like Facebook groups, mostly out of curiosity as a first time mom navigating this. I'm in like a due date group, which is a real interesting slice of people from all over the world who are due at the same time or the same month that I am.
Wow.
Sometimes vaccines come up in there. That can be interesting. And then, I work in vaccines professionally, and we kind of keep tabs on what some myths are about vaccines and pregnancy and breastfeeding. I think the big thing that sticks with me is during pregnancy, there are so many things that we're told to watch out for or to not put in our bodies.
Yes.
And I think that it can put people in a very defensive frame of mind as far as like exposures. And I know this is the work that MotherToBaby is doing all the time, and we're so grateful for. But I think it makes pregnant people wary
Yes.
of vaccines and susceptible to myths, especially about vaccine safety. So I think some things that I've heard are that certainly about the concerns about specific vaccine ingredients. And I think that comes down to that anxiety and hypervigilance. And, in our work at Vaccinate Your Family, we have done a lot of breaking down to a really sort of digestible level the reason why the ingredients in vaccines are not something that we need to be concerned about, right? Like you're exposed to more aluminum when you drink a can of soda or seltzer than when you take a vaccine, and just kind of right sizing those exposures and those fears, and kind of reinforcing that these are things where we have more safety data, more evidence to support that the benefits outweigh any potential risks than like anything else we put in our bodies, then the prenatal vitamins that we're taking, then, really like eating out at any restaurant, the list goes on. This is something that we actually do have a lot of evidence to support the use of. Another thing that I hear sometimes, I want to talk about the new RSV vaccines because they are newer, and I think people feel like it's not viewed as safe by some folks because the RSV vaccines are a new vaccine. And, for me, I think, it's relatively new, but it's a type of vaccine that's been around for a long time. It's undergone that extensive testing, and I think that it's easy to consider, again, because we're in this reactive, like fear-based, wanting to avoid exposures place, we forget to weigh the benefits of the thing, the benefits of getting vaccinated, and we forget about the risks of not vaccinating. And I think that's something that, especially with RSV, I'm thinking about. Like I said, the risk of not vaccinating is having a newborn during RSV season. That's a significant risk that you have much less control over. And I think that, weighing all of those things and kind of being aware of my own cognitive bias I think we're really biased toward inaction, toward like, I can stay safe by avoiding something during pregnancy, because there's so many things like that, right, that we're told to avoid. So I think that it's easy to have a bias towards saying, I'm going to make sure I don't do anything that could harm my baby, the action being get a vaccine, when actually the choice to not vaccinate is not a risk-free choice, but our brains don't like that. They kind of go, wait. I think we're more afraid of the potential outcomes for things that we do choose to do versus choose to not do. But of course, when we take a step back, thinking about the risks associated with not vaccinating and the benefits that come when we do choose to vaccinate on top of all the safety data that we have. I think it's actually like a really exciting opportunity to get to, using the example of the RSV vaccine. For some people who are concerned about the number of shots that infants get, getting the maternal vaccine now is actually a way to get one less shot for a newborn baby, because there are options right now for either a maternal RSV vaccine or an antibody that's given to newborns, two ways to protect baby against RSV. But it's exciting as a expecting mom to be like, okay, this is one thing I can do, to do one less shot for my baby, which I would get if that was the only option. But it's like, just reframing it as a positive thing to kind of be able to, without any risk to myself, like the risk that would come from getting sick, be able to pass antibodies onto my baby during this time window is actually really exciting. So kind of taking those myths and trying to get to a positive place of like, well, we have the opportunity to pass some protection on, and we don't want to miss that window of opportunity while we're pregnant.
When you mentioned, thinking about myths specifically, you also mentioned something that unfortunately is not a myth, but does contribute to the myths. And that whole thing is what you can and cannot do during pregnancy. And I'm so glad you mentioned it, and we're not going to go too far, but I'm so appreciative of it, because I don't think that we, and by we I mean society in general, mention this enough. My goodness, there is so many different things that there's so much conflicting information. There's so much fear around doing the very simple things. It's like, is my bath water too hot? Did I wait too long to get the vaccine? What if, I missed the window because of the season, or it wasn't available where I am, and now, it would be a better idea for my baby to get the RSV. There's so many different things, and I just want to say, I know we've said it a couple of times before, and I know that folks in our business say it all the time to the people we're with especially, but you're doing a good job. If you're out there and you're pregnant, or you're trying to get pregnant, or you were just pregnant, or maybe you're breastfeeding, or maybe not, but you might have a newborn or a newly adopted child on your hands, I'm here to tell you, you're doing a good job. You are. Yeah. And it's hard out there. And I just so much, Dana, appreciate not only what you do and everything you've said, but I just appreciate so much that you've mentioned that there is a lot out there for a person who is pregnant to navigate. And a lot of it is am I doing it right? And how can you not at some point, even for a second, make that question with everything you see? Don't eat that lunch meat unless it's cooked. Make sure you're doing X, Y, or Z. Make sure you're not doing X, Y, or Z. And again, you, Dana, are doing it right. And everyone out there making that effort, which I know you are. We know you, we see you, and we know that you're doing a good job. So keep up the good work.
Yeah, I so appreciate that. And I think if you're anxious about vaccines during pregnancy, of course you are, because we're anxious about everything that we're putting in our bodies. And I think there are so many messages that we receive from our communities, from healthcare providers sometimes, from our
families
culture,
sometimes,
about to be in a place of vigilance and fear, and to do it right. And so I have friends who have never worried about it before, but are having trouble with anxiety just around food decisions because they're pregnant. And it's, I think, been a really interesting, eye-opening experience. And if we're suddenly really anxious about our dietary choices, of course we're going to be anxious about a vaccine that we know less about, or that, has the power to be interacting with our immune systems. Like, it makes sense. So I definitely want to say, like, this isn't to say, oh, just don't worry about it.
Right.
We're conditioned to feel worried, and it means we care. But there's a lot of stress that comes with it too. So yes. I appreciate that.
And yeah, that's a big thing. And then what we hear about is how you're supposed to reduce stress in pregnancy. But again, I mean, we could honestly, we could have, and we very well may actually, this entire body of work and your experience is so inspirational. We might end up doing hey, we should just talk about some of the silly things we hear in pregnancy. But what I would also love to get to, so aside from the myths, right, what are some of the other frequently asked questions do you get about vaccines in the pregnancy breastfeeding space? Yeah,
so I actually recently was kind of scrolling through the due date group that I was telling you about, because I think it's such an interesting slice of life, different from other Facebook groups I'm in where it's people from all over. And the thing that we have in common is that we're due the same month. So I was this is, the comment section, it's not for everyone, but it is really interesting just from a what's on people's mind kind of perspective. And something that I came across several times that I worry about from a health communication perspective is that people really feel like vaccines during pregnancy are pushed on them by their care providers. And that I thought was an interesting trend. It's not everybody, right? But it came up more than once, that I think it comes down to a communication and a trust and information issue where, care providers are strapped for time. They're doing their best. Obviously want to give them the benefit of the doubt, but the way that we're presenting information about vaccines to pregnant people is making people go whoa, I feel like that it's assumed that I have to do this. And people are coming to groups and saying can I say no? Do I have to do this? And, it sets up kind of an adversarial relationship that I think, as a communicator, I'm I wonder how we can do a better job coming into those conversations with information and feeling like we're making an informed decision, so that when our care provider says, oh, you can do the Tdap today, do you want to do it? It doesn't feel like we don't interpret that as get your Tdap and that being the first time that we've thought about it.
Right.
But, in my experience, my care providers, who I really like, didn't bring up the Tdap vaccine to me until it was the week that we were going to do it. And they just said, oh, it is time for the Tdap vaccine. Here's the, information sheet about it. Do you have any questions? And if I didn't know a lot already, which I do because it's my job, about the Tdap vaccine, if I didn't see it coming and I hadn't anticipated it, it might feel, and I think for many people does feel, just this this thing that's really blasé, casual. And doctors who give vaccines all the time, I think, do treat vaccines casually sometimes, because they are an amazing public health tool that are safe and they work well, and we love them because they prevent illness and are extremely safe and have very few side effects. So as a care provider, you're vaccine time, woo! But as someone who's in a place of vigilance and worry about what's coming into their body, especially at the doctor's office potentially, I think I would love for everyone to be able to anticipate that vaccine conversation coming in a positive way. Oh, I know what that is. I know how I'm going to benefit from it. I already, if I have some questions, I know what to ask, because you probably don't. I mean, I've had that experience. You're in a conversation with a care provider, you are hearing about something for the first time, you don't have your questions ready to go. They come later, and then you end up on Google, and that's not what we want. So, yeah.
That's definitely true. I mean, Google and other search engines, have their place, certainly. But you had mentioned earlier, I believe what you had said was a trusted messenger, meaning a place of information that is based on available evidence, and while there's certainly other forms of information, I think knowing where and how to get that trusted information is really important, just sort of generally speaking. And then to your point, when you go into your provider, right, you want, and we hope, and that's the goal, is that the person or the group that you're speaking with is a trusted source of information. And as a provider, also not necessarily in this space, I do understand that feeling when I go in as, well, of course I know what I'm talking about. I'm a provider. I've been doing this for a while. So the two sides of it are completely different and coming from completely different places. And I think it's wonderful when we can come together, as long as you realize, it helps if you have some information going in. And it helps if your provider also knows how to address, explain, and fill in the gaps for the information either that you may not have or that you may not fully understand or that you may have additional questions about. So again, I do love that it ends up being a two-sided piece, right? We say all the time, you have to advocate for yourself as a patient, which is absolutely true. But from the provider piece, we do like to say, hey, you have to make sure that your patient has this information in that magical place when all of those things can happen in a way that everyone's comfortable with. That's where we are. Until then, we need to keep looking for information and looking for the best way to give and support that information as well.
Yeah, absolutely. Going back to your previous question, the other thing that comes to mind for me about just frequently asked questions, things that come up about pregnancy and vaccines, I do think there are a lot of concerns about vaccine reactions during pregnancy. Mm-hmm. And by that, I do just mean sort of the side effects that can happen when you get a vaccine, that like feeling a little bit sick. Everybody's different. So I don't want to claim to know what someone else's, vaccine reaction looks like. I think they've gotten, it's something that's been talked about more because I do think anecdotally, the COVID-19 vaccines, people are experiencing that, some vaccine side effects. Many people get them from seasonal flu shots too. Many people, children get them after their routine vaccines. You might feel a little gross for a day or two. It is normal and it is expected. It doesn't happen to everyone, but I think it really throws people off. And when you're pregnant and you already feel bad and it is hard to get through the day at work. And honestly, I really get this. My friends, we are already pregnant, probably working during pregnancy, probably worried about the amount of sick time that we have, if we're lucky enough to have it. Thinking about our schedules, maybe you have other kids and the weekend's not a good time to get a vaccine and be down and out. We feel like there is not a lot of buffer for feeling unwell. And it's hard to choose something like getting a vaccine that you have a guess might make you feel kind of not well for 24 hours. It's hard to choose to do that.
Yeah.
And people are definitely asking oh, how did you feel? And worried that during pregnancy you might actually feel worse. I will say that hasn't been my experience. I think there's probably a few different reasons for that. I'm well, I'm already taking it easy, so I haven't noticed it as much, or, maybe my immune system's working a little differently, so it hasn't been worse for me, I'll say, even after I've gotten vaccines during pregnancy, to just put that out there. But I was concerned, on a personal note, well, it's already a lot. How am I going to feel for the day after I get these vaccines? Am I going to have to call in sick? And I think, we can't dismiss those are real, decision-making kind of things that we're weighing in our day-to-day lives.
Yes. 100%. And I appreciate that, because not everybody has a sick day. Not everybody can take a sick day. And again, it's sort of how things are presented. There's lots of other issues, but, I can tell you from the how you feel piece that during my pregnancies, especially my last two, if there was anything I even thought was going to make me feel even more fatigued, I was I don't even know what more fatigue looked like. More fatigue probably looks like me just not being awake at all.
Right.
And that's real. Now, I do want to say that I did choose to and had vaccines available to me during all my pregnancies, and that's something that our family had decided was a personal choice. But I do want to, say that even though I work in the field, I've had those thoughts. These are typical thoughts. It's okay to have these thoughts, However that weighs into your decision is completely up to you, and maybe a conversation with your healthcare provider. But I did want to say, I've definitely thought about that. And then I was like, well, you know what? I really am more worried about this. And then I weighed it. But it is absolutely typical to have those thoughts. Like, I don't want to have to go to Walgreens. What if I have to miss a day of work? I don't want to feel sick. I definitely don't want to feel tired. And then again, if it's all part of your decision making, then that is something that a lot of people have typically experienced. So Dana, before we let you go today, is there a final thought you would like to leave our audience with?
Well, I would just say, I mentioned a lot of vaccines by name, and I would encourage anybody who is thinking about, is pregnant, knows somebody who is, if you're looking for more information about the vaccines that are recommended during pregnancy, what they are, why they're recommended, what the benefits are. We have some great information at vaccinateyourfamily.org. There is some pregnancy-specific resources as well as information about accessing vaccines during pregnancy. So I would just say, please check it out. Come with an open mind. We say do your own research, and I support that. Do your own research. Yeah. We have, all our sources. Come to vaccinateyourfamily.org, and I hope you'll take the time to kind of learn more about the vaccines that are recommended during pregnancy so that when it comes time to talk to your provider about them, you can go in feeling informed and ready to have that conversation and make the vaccine decision for your family.
Because that's the goal. The goal is making sure that you have the information that you can use to make the decision that is best for yourself and your family. And, wonderful organizations like Vaccinate Your Family do have evidence-based information that can help you with your decision making. And we will be happy to put information on how to find Vaccinate Your Family in our show notes. Dana?
Fabulous. Well, thank you so much.
Oh, thank you. Thank you doesn't even cover it. So happy to have you here today. So happy to talk about this. And as you know, vaccines are more and more a part of some of the recommendations that we have at all points in the life cycle. So we would love to have you back on the show in the future if you're ever ready to do so.
Yeah, absolutely. It's been a pleasure.
Great, Dana. Thank you so much. And that's going to do it for this episode of the Mother to Baby podcast. Be sure to hit that subscribe button so that way you never miss a new episode, and you can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. And if you want to be on the podcast or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contactus@mothertobaby.org. And Mother to Baby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. If you would like to support the Mother to Baby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website. Visit mothertobaby.org/donate today. Until next time, remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit mothertobaby.org.